So my name is Ahmed Elgheriany. I'm a fertility specialist at Janet City Fertility, London. Why I decided to become a doctor? It's a long story, but I will keep it short. When I was very young, I had this enthusiasm to help people, and I felt that being a doctor put you in a position that you can help too many people throughout your life, involuntarily or subconsciously, because this will be your nature. And I had also the scientific mind, or nerd mind, I will say, to keep study and read and try to look for something new and advanced. So I thought that the medicine will be the best place that I can help in the future and, fulfill my eagerness for science. What made me to specialize in gynecology and fertility? So when I decided to go to the medical school, could be 20 years ago or more than 20 years, I couldn't remember. I started to study and review all my lectures on the gynecology and obstetrics ward. I was sitting in the delivery ward, reviewing and doing my study and everything, and seeing women delivering, seeing cesarean sections, going to laparoscopic operation, gynecological operation. I had this deep enthusiasm about the obs and gynae since I started my joining the medical school. And the only thing for that, I had my personal experience with my sister when she was trying to deliver, and she was difficult to deliver and needs some tricks to get it delivered naturally. And this just pushed me when I was too young to why don't I be the best doctor to help women in this stage of their life. So I decided to be in this field from the first year of my medical school, whatever I will have. The most rewarding thing about my job, if you are treating patients with infertility and you feel what they are passing through it, you can imagine how difficult the journey for them, how stressful the journey. Some couples may just break up, some may just increase bonding together more and more. So when you are dealing with them and you just feel their emotion and try to be a tool to help them to have a baby, and you are able to do that, it's the most beautiful feeling ever. You just help people to have joy in their life forever. And so it's very emotional. And if you imagine one of my patients, she has many cycles of IVF, and we kept trying with her, and she hasn't disappointed. And at the end, when she delivered her girl, she named her Dream. Her daughter name is Dream. So it's something very rewarding to help people with infertility. On the other hand, with difficult deliveries, with difficult gynecological operation, to reach the diagnosis sometimes could be problematic. And if you are lucky and you are able to multi-thinking and just open your mind to see the whole spectrum of obs and gynae, so definitely we can guide them to the true track. And this is something very important, especially nowadays. Some generalists, some not specialized, may just give false information, and just patient may get lost easily if he hasn't received quite good information. So if I will say the most rewarding thing is to guide people to the right track in their life and to help them to have their own dream and to achieve their family.